You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, what every cancer patient needs to know about acupuncture and Oriental medicine to help them with their treatment. With us, we have an expert on this topic, Christine Adamo. Welcome to the program.
Thank you.
So Dr. Adamo, so for people that don't know you or your practice, who's your typical patient? I guess this is kind of your specialty.
You know, I don't actually have a typical patient. I would say I see all patients that are going through conventional cancer treatment. So these patients usually are referred right after they're diagnosed. They're getting ready to start a chemo regimen or radiation or surgery or a combination of all three. They're generally referred from an oncologist, either medical or radiation oncologist. Sometimes they're referred by nurses in an infusion center. A lot of times, like I said, they start in the very beginning of treatment, but I can also see patients that are halfway through their treatment, then they hear about me and say, you know what, I want a better quality of life, I want to minimize some of these side effects, and I just start treatment right there with them.
Okay, good. And acupuncture, I guess, has become mainstream when it comes to cancer treatment. I mean, all the major centers are doing this?
All the major centers. If you look at the top four, Sloan Kettering in New York, Memorial Sloan Kettering, MD Anderson, which is in Houston, Texas, Dana-Farber in Boston, and UCSF. They've all incorporated acupuncture into their facilities, so the patients are actually receiving treatment while they're going through treatment, either the day before, you know, during the treatment, or the day after.
But you also do more than just acupuncture, right? You're doing herbal, nutrition. Tell me about that.
So I provide complete holistic support for patients because I think acupuncture is a wonderful modality to incorporate, but there's so many other things that we need to really work from a holistic perspective and change the internal terrain of the body. So a lot of times we need nutritional support, supplements, maybe herbal remedies to really bring the body back into balance. In the field of holistic medicine, we look at every sign and symptom that a patient has, or even Western medical diagnosis is really just an alarm to say that your body's out of balance. And so the focus of holistic medicine is to put the body back into balance.
Okay.
And when there is balance, there's no longer disease or dis-ease. So many times we can treat kind of underlying things that are happening in the body while a patient is going through cancer care, which can make them stronger and enhance their immunity. If we take the same approach, it can also minimize or mitigate the side effects of the treatment.
Okay, good. Now, you know, I asked you in the green room, and I'll ask you again, because acupuncture is one of those things that's somewhat invisible, right? With freeing up the chi, etc. And I have a limited understanding about this. But how do you prove it? How do you know if it's working is my question.
Well, you know, I will tell you, I started my practice about 8 years ago in a cancer center, and I had very little proof to be able to say, hey, I know I'm going to be able to treat your patients and really help them with their side effects. So when I started 8 years ago, I was just treating in their facility, and I knew that acupuncture worked for the general population, but I hadn't really worked with patients one-on-one to see if they, you know, one patient would get better than another. Now, 8 years later, my whole practice has grown because of that. I work in an infusion center 1 day a week, and the nurses can see the difference between two patients that have the same clinical diagnosis or are receiving the same chemo regimen, and yet one patient will come in with the very, you know, side effects that are very common to that regimen.
Which are?
Nausea, vomiting, fatigue, peripheral neuropathy, insomnia, a number of different things, lymphedema if they have breast cancer. And another patient, you know, one patient's doing remarkably better with the acupuncture, the nutritional support, than the patient that's not receiving the holistic care. So these nurses are actually what have built my practice today. They started to see this. A lot of them came in and said, hey, can I be your patient? I have general aches and pains. Wow. I have digestive problems.
So there's a noticeable difference.
Absolutely.
With the downtime of symptoms, because after the treatment, they feel pretty lousy. Is that right? Fatigue, everything else.
Absolutely.
This lessens that? I mean, that's what you're seeing?
Absolutely. Let me give you a little story here. I had a patient that came in last spring. He was going through radiation treatment. He had throat cancer. So him and his wife came in with every supplement in the world, and they wanted to use a supplement and vitamin to, you know, prevent things that they anticipated happening. And they wanted to know, what was the best way to help prevent the side effects, keep the immune system strong, really help this patient through their treatment. So the first thing I did was said, we have to streamline what you're doing here, because we really need to focus on targeted nutrition, things that look at the underlying mechanism for the treatment that you're going through. So instead of 75 different things, let's just pick 4 or 5 supplements that would really support you. Maybe a multivitamin, a protein powder to kind of keep your weight up and help with lean muscle mass, curcumin or boswellia to help reduce the inflammation of the treatment. Luckily, they were very, very receptive. I changed his diet completely. I put him on a whole food-based nutrition plan that focused on not only getting him adequate calories, which is important for throat cancer, but also reducing inflammation, and had him come in every week for acupuncture. So his treatment was, I believe it was 7 weeks of chemotherapy, 35 radiation treatments, which he did every day for a total of 7 weeks. And at the end of that, one would have expected that this patient would have the side effects of sore throat, swelling of the glands, difficulty swallowing, and the inability to eat. One big thing that we see with head, neck, throat cancers is that when patients receive radiation, they usually lose the inability to eat, they lose their appetite, they can't swallow. Okay. They have to get a feeding tube, usually halfway through the treatment. This patient was able to completely get through without a feeding tube. He was able to eat soft, solid food through the whole course of his treatment. His pain or discomfort level was only at about a 3 or 4, and most patients would say 7 or 8, where they're put on heavy pain medications. No nausea or vomiting, which is a big side effect that comes up with the chemotherapy.
Interesting.
And peripheral neuropathy, which did show up at the very end of his chemotherapy, only took about 3 acupuncture sessions. And the peripheral neuropathy is actually a very big thing. So I don't know if you're familiar with the peripheral neuropathy. Okay. So what it is, basically in layman's terms, is numbness and tingling that occurs in the hands and feet. But this is actually really, really a pretty incredible thing that shows up, because it can get so bad that people lose tactile functions. They're unable to do everything from button their shirt, unscrew maybe a jar, reach into the refrigerator. If it affects their feet, they're unable to walk. It affects their balance, coordination. They become a fall risk. So it's really detrimental to their quality of life. And many times we have to stop chemotherapy because of the peripheral neuropathy.
So you're giving herbal remedies, herbs, combined with anti-inflammatory diet and the acupuncture. I'm curious, what do the radiation oncologists have to say about these herbal remedies?
So that's
Are they worried about it?
Yeah.
Are they anti?
Well, that's a really interesting question. Years ago, when I started my practice, about 8 years ago, I think there was much more concern about that. I think now that there's more information available to the general public. There have been studies to show that these supplements can be extremely beneficial. I think that there's less of that hesitation. I recently had a radiation oncologist call me from Sharp, and this is with a patient that we kind of co-treated together. The patient gave him my name and number, and he called me and he said, I'm a little concerned. I know you do the nutritional work. I know you're going to put the patient on supplements and herbs. I'm a little worried about interaction. So I shared with him my plan. I said, absolutely, I would be worried about interaction too, because there are a number of herbs, supplements, and vitamins that are contraindicated during radiation. But I disclosed to him, this is my plan. We're going to take the patient off fish oil. We're going to take them off strong electrolytes, which do interact. These are the things we're going to put them on, and a reason for every single one of them. He complied. It was good. The patient went through the whole course of treatment. Once again, at the end, the radiation oncologist called me and said, wow, I cannot even believe how well this patient did. And
this same person is sending you more and more?
Absolutely.
Is that right?
Absolutely.
They are believers now.
They are believers.
So is this limited to certain types of cancers? Or
Absolutely.
Do you work with all types of
All kinds of cancer, absolutely. Because, years ago, there used to be specific kinds of cancers. We would say, oh, this person has breast cancer, and this was the chemotherapy that was used for breast cancer, or this person has colon cancer. Now we're into looking at cancer as more of a genotype and saying, okay, what is the molecular component that's driving this cancer, we now use chemotherapies across the board. So chemotherapies that were used for breast cancer for years are now being applied to different parts of the body. And therefore, using acupuncture, herbal medicine, nutrition, we can apply these same treatments to patients because we know that they're going to have the same side effects based on the chemotherapy.
Now, do you have, I know somebody in cancer treatment. She's been in it for years. And I know she comes to San Diego from Palm Desert once a month, at least. And it may be twice a month. Are those people, do you have people like that that started your protocols, right? That say, oh my goodness, I feel so much better after than I did before?
Oh, absolutely. Yeah, definitely. I have patients even that I work with that are not located right here in San Diego. So most of the time, you know, I try to get patients in the very beginning. We start their treatment, we do a pre-treat. I do this with acupuncture. If I know somebody's getting chemotherapy on Wednesday, I have them come in on Tuesday or early morning on Wednesday. And it helps minimize or mitigate the side effects. And their treatment protocol with me is just prior to the chemotherapy. But they'll follow me through the whole course of treatment. And then at the very end, we kind of keep them up for, you know, health and wellness and any other ailments that are going on in their body.
Now, this is obviously an emotional time for these patients. Not everyone is saying yes to acupuncture that's in treatment. Why is that? Skeptical, like I am going into this, like I told you in the green room?
I think there's some level of skepticism. I also think that patients can feel overwhelmed, right? They just get a cancer diagnosis. They don't even know where to start. The chemotherapy, you know, most chemotherapy and radiation treatments really consumes a lot of time for them. And that's why I feel it's so beneficial for me to have a practice where I'm actually in the facility and I can treat those patients. They don't have to make one more appointment. So I can just co-treat with the doctors. It's a wonderful...
We should mention your credentials. You're not a typical acupuncturist. I guess you have a master's, a doctorate. Tell me about that.
So I'm a doctorate of Acupuncture and Oriental Medicine. I received both a master's and a doctorate from the Pacific College of Oriental Medicine here in San Diego. And after that, I actually went to Chengdu, China to study in a fellowship program, specifically on oncology. Since I've been in practice, I've focused all of my, well, I shouldn't say all, but much of my effort in the field of oncology. I'm doing continual research and continual education units.
Are you ever surprised at the outcomes?
From time to time, I am. I am. You know, learning acupuncture and learning traditional Chinese medicine, you're in a clinic and you're going through school, you see a general population. In oncology, you see patients that are really, really sick.
Wow.
And I have had times where I've thought to myself, you know, I don't really know what my potential is here. I don't really know what role this will play here. This is different than the general population. This is not just digestion. This is not just somebody has a headache. They're seriously ill. How strong is this medicine? So I am surprised.
So let's talk. I wrote down a list of some of these symptoms that people have: nausea, vomiting, constipation, diarrhea, loss of appetite, fatigue, hot flashes, night sweats, the peripheral neuropathy, tumor-related pain, postoperative pain, etc., dry mouth. Those things are lessened in your experience
very
by
much
acupuncture and the herbal and the nutrition.
Absolutely, very much they're lessened. You know, and the other thing is that I really...
Lessened? Are there those miracle stories where people don't, that very
Or
minimal?
Mitigated. I would actually say...
Really?
Or mitigated.
So no symptoms at all?
No symptoms at all. I've had patients that expected to be nauseous are not nauseous. Usually ginger capsules and acupuncture can take care of that. I've had patients that we anticipate they're going to have peripheral neuropathy. I start an acupuncture protocol with them as if they already have the peripheral neuropathy before they get the chemotherapy, and it either minimizes or mitigates the side effects of the treatment.
Do you get hugs?
A lot of hugs.
I have a question about insurance. Insurance does not cover this?
Insurance does cover a portion of the acupuncture, some of the PPO plans. I'm an out-of-network provider.
I know it's not a lot of money, by the way. I asked you how much it is. It's not a lot of money.
It's not a lot of money at all. And for the benefit, I mean, that's what you think about. This is the quality of life. So, you know, when you think you're going through cancer treatment, what would you rather have every week? Would you rather get your hair done, or do you want to feel well? You know, when
this is a lot less than getting your hair done, by the way.
Absolutely. So when you put it in that context, why wouldn't you want to feel well? Usually standard, you know, PPO plans do cover acupuncture. Some HMO plans do cover acupuncture. Nutrition, supplements, vitamins, things of that nature are not covered.
And how long does it take you to do? On the typical patient, how long are you with each patient?
Approximately an hour each patient.
Okay. And it's relaxing for them?
Extremely relaxing.
Their eyes are closed, they're relaxing?
Many patients actually fall asleep during the treatment. Acupuncture is the insertion of very, very thin needles.
And it's safe. I mean, is that behind us now, that it's safe? Everybody pretty much acknowledges it's safe?
It's very safe, especially in this population. I think there was a concern years ago from medical oncologists and radiation oncologists. You know, these patients are immunocompromised, and then you're going to put a needle in the patient? I don't know how safe that is. What we know is that, you know, licensed acupuncturists in the United States, we are only allowed to use needles that are sterilized. They're prepackaged. After they're inserted into the body, we take them out, we put them in a sharps container. We're trained to use alcohol swabs before the insertion. And then the other really important thing is, regardless of what acupuncture points you put in the body, it enhances the immune system. What we can actually tell is that the white blood cell count comes up, lymphocytes, neutrophils, and even killer T cells increase.
So this should be, you're of the opinion then, and you say medical oncologists, radiation oncologists seem to agree that this is just another immune system booster?
Absolutely.
To make everything better? Mm-hmm. But, so good. So people that are watching this, if they want to get in touch with you, they go to your website, they get to see you face to face. Do you have a private office, or do you work in the hospital or the cancer center?
I have both. I have a private practice in Escondido, which is located next to a cancer center. And then I also work in a cancer center in Encinitas one day out of the week.
So part of your evaluation, because one of the things you said is people come in with a bag of supplements from different places.
Right.
And they're just kind of guessing or winging it, or they look online, and that could be dangerous. Is that correct?
It can be very dangerous. It can be dangerous for a number of reasons. One is that, you know, we think about these mechanisms of action that are behind every supplement. Everything you put in your body creates a chemical reaction. Think about when you were a child and you were in chemistry class, right? And you just mixed vinegar and baking soda and you saw this explosion happen in front of you. Those are the two most benign household substances you can have, yet they can create a really strong chemical reaction. It's the same thing when you start to mix pharmaceutical medications, vitamins, supplements, and even food. So one thing I really stress with my patients is that don't go buy things over the counter and prescribe and self-treat, because you really don't know how these things are going to act, react, or interact with one another. In my practice, I think it's really important to use pharmaceutical-grade supplements.
Okay.
Very different than the over-the-counter.
So your protocols have been proven at this point. I mean, you're 8 years into this, based on whether it's chemo or radiation,
right,
and the medications, and you work with their medical oncologists and their radiation oncologists, if necessary, to do this. Well, good for you.
Thank you.
So, and for that person that is considering supplements, obviously they could hire somebody like you, a coach, to look at it, evaluate it, and give recommendations.
Yes, and that would be the only way that I would recommend that they do it. I say, even if you don't live anywhere near San Diego, I don't recommend patients just take this on their own. You know, they really need somebody to help guide them through what is right, choosing targeted. And as you know, as their course of treatment changes, as they navigate through chemotherapy, as they navigate through radiation, their supplement plan changes as well. As I mentioned, there are a number of interactions that do occur. So they really want to work with somebody that has a strong knowledge of drug-herb interaction and a strong knowledge of oncology in general.
Okay, good. I want to thank you for coming on the show. Very interesting. And if somebody wants to know more, they go to your website. There's information there. Do you blog about this, speak about the topic?
I do both. I have a newsletter that comes out about every month. I do some talks around San Diego. I've been at Cal State San Marcos. I've spoken a number of times.
Okay, good. Well, again, thank you for coming on the show. Great
Thank
stuff.
you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez for now. I wish you good health.